The signals being sent back and forth between your brain and your body through the brainstem are electrical signals. When electricity is impeded, as is the case, for example, when a light bulb stops the flow through the cord from its power source, then it produces heat. The brainstem subluxation, the term we use to describe the upper neck misalignment when it has adversely affected the most important organ in the body, interferes with the electrical flow in your body through your brainstem, causing consistent waves of inflammation, the byproduct being heat. Inflammation has developed a reputation as something that must be struck down fast and hard because of its association with pain, but inflammation is actually one of the body's primary tools for healing. When a problem arises, inflammation comes in to serve and protect. It'll set up a perimeter. It'll help fix the problem. It'll stick around for the cleanup. Then it'll go on its way once the problem is solved. To further your understanding of inflammation, it's probably a good idea to separate it into two categories in your mind. The first, like stepping on a rock, and the other like stepping on a splinter. If you step on a rock, the inflammation is pronounced and immediate, and you feel it accordingly. It also goes away fairly quickly. In a few weeks, it's like nothing happened. Step on a splinter, though, and don't take it out, the inflammation is far more subtle, but you're not on and off of it like a rock. So the injury's cause remains, and the injury remains, causing an inflammatory response that will also remain until the splinter is gone, allowing the healing process to be completed. The distinction is important because it gives thermography's findings context. The splinter, like cancer cells or laying down in one position for weeks in a hospital bed, or the upper cervical brainstem subluxation, all cause something called pressure atrophy, which means that abnormal pressure on living tissue causes that tissue to break down, which causes an inflammatory response to address it. But that won't go away until you remove the source of the pressure. Thermography is concerned with the inflammatory response that sticks around because the work can only ever be a percentage of finished. Inflammatory patterns are its concern. Keyword patterns. Not random inflammation, specific. For us, this tool is like blood work would be for more traditional physicians. There are established normal values and abnormal values. Blood work is a gauge to determine an appropriate course of action. Thermography is our gauge to determine whether or not the brainstem has been compromised, and also our tool to measure if our methods to correct what caused the brainstem to be compromised have been successful.